Hi everyone. Um, I'm
Hold on one
Berdith.
second. One second. Karen and Birdie. Okay.
Yes.
Okay, you're gonna start.
Okay. Hi everyone. I'm Berdith, and my partner is Kevin. We are presenting a myelin disorder, metachromatic leukodystrophy. Okay. So, what is metachromatic leukodystrophy? MLD is a rare hereditary disease characterized by the accumulation of fats called sulfitides. The buildup occurs particularly in the brain, spinal cord, and peripheral nerves. Nerve cells covered by myelin make up a tissue called white matter. The, the sulfatide accumulation in myelin producing cells cause progressive destruction of white matter leukodystrophy throughout the nervous system. In people with metachromatic leukodystrophy, the white matter damage causes progressive deterioration of intellectual functions and motor skills. Metachromatic leukodystrophy gets its name from the way the cells with accumulation of sulfatide appear when under a microscope. The sulfatide form granules that are described as metachromatic, which means they pick up color differently than surrounding cellular material when stained for examination. There are three forms of MLD, which involve different age ranges: late infantile form, juvenile form, and adult form. So, how does this happen? So, this condition is inherited in an autosomal recessive pattern, which means both copies of the gene in each cell have a mutation. Most individuals with metachromatic leukodystrophy have mutation in the ARSA gene, which provides instructions for making the enzymes aryl sulfatase A. This enzyme is located in the cellular structures called lysosomes, which are the cell's recycling center. Within lysosomes, aryl A helps break down sulfatide. MLD can also be caused by detection in sapospin B, also referred to as the cerebral side sulfate activator, which is a protein required for ASA to work properly. So the late infantile form. This is the most common form of MLD, affecting 50 to 60% of individuals. Babies usually develop this after the first year of life. Most children die by the age of 5. So with a child with a baby, you'll probably see how they have difficulty walking, weak muscle tone, developmental delays, difficulty speaking, progressive loss of vision that leads to blindness, difficulty swallowing, and even dementia. And then in the juvenile form, this usually occurs when they're around 4, and it lasts to like 4 to 12 years of age. And this is around 20 to 30% of people with MLD have this form. The juvenile form doesn't progress as fast as the late infantile form, and the survival is generally less than 20 years after the symptoms begins. So these symptoms similar to the infantile form, and then it also includes behavior problems, difficulty with schoolwork, seizures, and dementia.
Okay, for the adult form, this is less common and typically starts after age 16. Signs progress slowly and may begin with behavior and psychiatric problems, drug and alcohol misuse, and issues with school and work. Psychotic symptoms are delusions and hallucinations. Adults may survive for several decades after initial symptoms. Next slide. Yeah. For the For the diagnosis, doctors use lab tests. They look for enzyme deficiency. Genetic tests also looking for mutations in the gene. Nerve conduction study. It measures electric nerve impulses and functions in muscles and nerves. A MRI. They use magnets and radio waves to produce detailed pictures of the brain and psychological and cognitive tests. This test determines how the condition affects brain function. Psychiatric and behavioral problems may be the first signs in juvenile and adult forms of MLD. For the treatment of MLD, there is no cure yet, but there are medications that can reduce signs and symptoms. Physical, occupational, and speech therapy. They promote muscle and joint flexibility and maintain range of motion. Nutritional assistance. This can help with providing proper nutrition. And other treatments could be used are wheelchairs, walkers, or other assistive devices. Also, mechanical ventilation to assist with breathing. And these treatments are used to prevent or address complications in long-term care or hospitalization. For the recent studies, the clinical cases of bone marrow or cord blood transplantation have been used, but they have been insufficient to prevent aggregation of neurological disorders. Encouraging results have been used are gene therapy for delivering the wild type ARSA gene by using vectors based on various stereotypes of adeno-associated viruses, as well as using mesenchymal stem cells and combined gene cell therapy. And here are our sources. Any questions?